So I was actually studying chemistry at Ohio State, and I was introduced to now my senior partner in the practice, Dr. Scott Gerwin, who'd already had a well-established podiatry practice, and I was trying to decide what I wanted to do with my life, and so I shadowed him and followed him in surgery, and decided that I really enjoyed, these procedures in the foot, and it was something I wanted to pursue. In terms of my practice today, I still perform the procedures that I was trained in during residency. That was one of the great things about my residency training program, is we did a high enough volume of different types of ailments that can go wrong with the foot and the lower leg in terms of wounds, that we graduate from that program feeling very comfortable in treating these conditions. And it's kind of expected that when you receive that high of a level of training, that you'll carry that into your career moving forward. In terms of medical education, I'm actively involved in training residents at the Grant Medical Center Surgical Residency Program. I am the externship director, so I am in charge of teaching students who rotate from the various podiatric medical schools through Grant Medical Center. And then I'm also the director of a fellowship program where we teach advanced surgical techniques to doctors who have already completed a surgical residency, but they want an additional year of advanced training. One of the things that I am the most excited about in terms of my practice is the staff that I get to work with every day. When our patients come through, it is so important to us that they have a positive experience and they feel like they're at a place where the people there really care about them. We've all been to the doctor, and sometimes you feel like you're just going through a mill or you're just on an assembly line, and we never want our patients to have that sort of experience. And I feel confident that when patients come through our practice, they feel like they are dealing with people who genuinely care about them, their family, and making them better. It can take quite a while to build a solid team. Anyone who's ever run a business or a medical practice or been on a sports team, or even anyone who's ever gone to a job, knows that it can be very difficult to assemble a group of people that work well together towards a common purpose. And in terms of the many years of practice that I've been in, I have never felt more positive and excited about the people working with us and how we're able to, as a group, make the people that trust us with their care better. The thing I love the most about what I do is being able to have someone come to my office and they're having a major difficulty in their life. There's a hurdle that they're trying to overcome, something that is preventing them from playing with their kids or being able to exercise and to achieve the level of health that they want to achieve. And to be able to solve that problem in order to make them better. Sometimes they may have seen multiple physicians prior to coming to us, and when we're able to give them their life back and their mobility, and they're able to do what they could do before, it's like hitting the game-winning shot in Game 7 of the NBA Finals, except we get to do it over and over again, which is extremely rewarding. And it's what makes it even more special is that it's one-on-one with someone or with their family, and it's an amazing experience, and it makes you want to get up and do what you do over and over again. In our practice, there are advances in medicine that have been coming about for quite some time, and the thing that we very much take pride in is the fact that our doctors are very involved in continuing education. And so, there may be a doctor that has been out of practice a few years and they're younger and they have the most advanced and current training, but also the doctors in our practice that have been in practice for over a decade actively seek out that continuing medical education so that as a group we are able to offer the latest treatments in terms of correcting arthritis and deformities. We're able to use advances in terms of tissue grafts and stem cell therapy and things that sometimes were not available when we went through our education and training. But we make the strongest effort to make sure that when a patient comes to our practice, they're able to receive the highest level of care that they can receive anywhere.